Hey guys, it's Elizabeth at Dr. Emer's and Danielle. We just finished doing Clear and Brilliant with Permea on our lovely patient Cecilia. And now we are going to be doing my fave, Cosmelan. I love this peel because it helps to suppress pigmentation and it leaves the skin radiant for months. On Cecilia, we're going to do it today because she has melasma on both cheeks, and you can see she's had it for about 10 years now. Cecilia shared with me that she developed this melasma after she gave birth to her children, and it has lasted quite some time. She tried a couple of other treatments, including TCA and other lasers, and they didn't seem to help. So we are going to be doing Cosmelan now, and she is definitely going to see major improvement, as Cosmelan is truly the #1 depigmentation treatment that we work with. I'm also going to be sharing all of this information in Español for all of those lovely viewers that like to speak in Spanish and understand Spanish a little bit better. So, Danielle, would you like to share anything about Cosmelan?
Should we talk ingredients or how they work? So Cosmelan is great for pretty much every patient who has pigmentation or who wants to just brighten their skin, make them look very radiant and even out the tone. What it's going to do is give your skin a very high dosage of hydroquinone and retinol. There are other brighteners in the compound, but hydroquinone and retinol work in a very scientific way to give you this exfoliation and the brightening. So retinols, they stimulate your cells to kind of release the damaged, basically any of the skin cells on the surface that have been damaged by the environment or by past treatments, day-to-day irritants. It's going to shed all of that. So you're going to have this very slow exfoliation process day-to-day that is revealing fresher, healthier skin, less lines, kind of more even tone, just this nice glow and smaller pores. That's from the retinol side of it. The hydroquinone is actually depleting the pigment cells from your skin. So it's telling the control gates of pigment to close the gates, to not let that pigment come out to the surface. So that is why this is great for releasing pigment from the skin that's already existing, but also as a pre-treatment for bigger laser peels, because it will not let your skin release as much of these pigment cells to the surface. Therefore, you're not seeing it on that surface level. So it's great to get rid of the past pigment and then also to make it so that you minimize the risk of PIH or post-inflammatory hyperpigmentation, which can be associated with some peels or some lasers, depending on the skin type or what the condition is that you have. So those two ingredients are really the powerhouses behind why this peel works so well. Of course, it is important that if you have any kind of allergy to that, this would not be the peel for you. We would find other ways, things like our lasers, to make your skin brighter, but those are the two big ingredients and kind of how they work. That's why you're getting a lot of that prolonged shedding, prolonged cell turnover, and that big car wash effect of taking off all the pigment.
Can I say it in Español now?
Yeah.
Okay.
De
lo que estaba diciendo Danielle, los activos principales en este peeling son hidroquinona y ácido retinoico. Eso va a ayudar a controlar la mancha y también a que se vea menos oscura la mancha. Es dos activos que trabajan de una manera muy agresiva y por eso vemos los resultados muy rápido. Normalmente se ven los resultados después de 2 semanas de que se ha aplicado el peeling. Como lo ven, es un peeling que es muy fácil de manejarlo. Yo lo apliqué un poco más grueso en las zonas en donde Cecilia tiene la mancha, que es en la mejilla. Y también nosotros podemos hacer un tratamiento de retoque en esa zona en 2 semanas para que los resultados se vean más, más en tono con el resto de la piel. I just translated everything you said. Yeah. We're talking about hydroquinone and retinoic acid. There are other actives in this. We are using tyrosinase inhibitors, or pigment suppressors, as Danielle stated. The other active ingredients in this peel are kojic acid, azelaic acid, arbutin, licorice extract, and phytic acid. Those are the fastest working tyrosinase inhibitors, and of course, hydroquinone is the fastest. Now, when you start doing treatments like Cosmelan, you do have to be cautious of the sun because hydroquinone does cause photosensitivity. So you want to make sure that you're wearing your SPF religiously. Should I say all of that in Spanish?
Yeah.
Okay. Cuando estamos haciendo un tratamiento como el Cosmelan, es muy importante que eviten el sol y también estamos hablando de todos los ingredientes que tiene Cosmelan. En total, Cosmelan tiene como 52 ingredientes, pero los más poderosos obviamente son la hidroquinona. Y cuando estamos aplicando este peeling, realmente no se siente nada. ¿Siente algo, Cecilia? No se siente nada. Este peeling se lo va a dejar Cecilia por 10 horas. Es un peeling que es formulado para trabajar en la piel latina. Me voy a hacer un lado. Es un peeling que es formulado para trabajar en la piel latina, en las pieles más oscuras y en las pieles que son mucho más sensibles al sol. Cuando Cecilia empiece a descarapelarse, que se va a descarapelar un poco la piel, va a tener que evitar el sol por 2 semanas. Y ahorita Danielle está terminando de aplicar el peeling. Es un peeling que se aplica un poco más grueso en las zonas en donde Cecilia tiene la pigmentación y las manchas. Y ya, realmente ya está completo el tratamiento. Danielle hizo un trabajo fantástico en aplicarlo. Y vamos a ver, Cecilia todos estos días nos va a estar mandando fotos para decirnos cómo está reaccionando su piel. Ahorita nos acaba de decir Cecilia que no siente absolutamente nada. Y así es como se va a sentir el peeling por 8 horas, 8 a 10 horas que Cecilia va a tener este tratamiento ahorita.
I think we should talk about a little bit what to expect after this peel, because you, of course, being a good candidate for this peel is very important, but then also one of the biggest questions that we get is what's the downtime going to be? So as far as downtime goes, you know, this peel we do say lasts 10 to 14 days. And really what you can expect is no pain when it's applied. She's very comfortable. It's not burning, but she'll be red and sensitive when it's washed off. And then kind of just red and sensitive. There may be some swelling associated with after the peel is removed. That is totally normal. Your skin is responding to this very high dose strong peel, and so that's great. After that swelling has worked its way down, typically the redness fades as well and the peeling process starts. So you're looking at that progression of red and mild swelling for a couple days and then some light shedding. I do tend to tell patients that if this is the first thing that they're doing for their skin, if they've never had a treatment, if they've never had a laser, if they've never had a facial, they're gonna have more intense peeling up front because there's more to get rid of. There's more dead skin cells to shed. But if they're, you know, routinely taking care of their skin, stimulating their collagen, exfoliating dead skin cells, then the downtime on this really isn't as bad.
No. It's for those that haven't. But also, let's not forget Cosmelan 2, guys.
Yeah.
Cosmelan 2 is just as important as wearing the Cosmelan peel. Cosmelan 2 will continue to suppress the pigmentation. It has the same exact active ingredients, but at a lower concentration. So I'm going to translate everything that Danielle just said. Después de que se quita la mascarilla de Cosmelan, la piel se va a ver roja, se va a sentir mucho calor y va a seguir usando la crema de mantenimiento que se llama Cosmelan 2, que tiene los mismos activos que la mascarilla de Cosmelan, y ese tratamiento se va a aplicar hasta 2 meses después de que se hace el peeling. Entonces realmente el tratamiento continúa con el Cosmelan 2. Es muy importante y sí va a haber un poco de irritación cuando se aplique la crema, pero es normal, y después de que se va descarapelando la piel se va a ver hermosa y se va a ver más tonificada y se va a ver más radiante y con obviamente menos manchas. Eso es todo.
That's the last thing. So we have a little bit left over. We've covered the entire area. We definitely paid attention to our trouble areas. We have some more, and when we do this treatment as a prophylactic treatment for bigger lasers, we usually apply it 2 weeks prior. That's the point where your pigment is the most suppressed. You've gone through the healing and shedding process. you're ready to go again. Now, because the pigment on her cheeks is her biggest concern, we can come back in and reapply this little bit to those trouble areas and go through another process of peeling and lightening the area when it is your trouble spot. So, you know, we really take good care to target those issues and then continue through our whole regimen. It is something that, you know, could be lifelong that you're improving or keeping at bay. So just really finding the treatments that work well for you, maintenance type treatments with lasers, or annual or biannual treatments with Cosmelan are really a great way to go about depigmenting.
Absolutely.
All right.
And as long as you're avoiding the sun, of course, and you are wearing your SPF, there's no reason why you would have to do Cosmelan more than twice a year max. As Danielle stated, in 14 to 21 days, Cecilia can come back and we could treat her melasma specifically on her cheeks, and it would be left on for the same amount of time, which is 10 hours. Acabamos de decir que después de 14 a 21 días, después de que le hagamos el tratamiento a Cecilia, le podemos hacer otra vez el peeling específicamente en las zonas en donde ella tiene las manchas y dejárselo 10 horas. Así es que sigue el tratamiento, no es nada más un tratamiento de una vez, y también tiene que usar las cremas adecuadas de mantenimiento y usar bloqueador solar, es lo más importante. Thank you for watching.
That's it,
Gracias.
everyone. Send in any
Bye.
questions that you have. Alrighty. How do you feel?
Good.
Let's